Hi, welcome back. What is Hashimoto's thyroiditis? This is one of the most common autoimmune diseases around. And specifically, it is related to the immune system attacking your thyroid gland. If you're new here, I'm Dr. Thyroiditis Autoimmune. I am an internal medicine doctor, and I answer questions related to hormones, to primary care issues, to weight loss, and also autoimmune conditions. And Hashimoto's thyroiditis is one of the conditions that I see very commonly in my practice. And just wanted to share, what is it? Why do people get it? And what can be done about it? So to answer this question, I'm actually going to probably end up doing a series on the thyroid, because the thyroid is a very important gland that affects a variety of things in our body, right? Different organ systems, different tissues. And so I really want to spend time expanding on what is the thyroid, why do we need it, and why does it cause all these problems, okay? So today I'm really going to focus on answering the question, what is Hashimoto's thyroiditis? But in the process, you really have to really understand how the thyroid functions, and that might explain why you get the symptoms you're getting that made the doctor test you for this condition, okay? So, thyroid disease. In general, we find thyroid disease in about 4.6% of the US population, and it is very prevalent in women, okay? We find, in fact, 1 in 8 women will be diagnosed with a thyroid disorder in their lifespan. Okay, so the only other statistics that's that common is breast cancer in women, right? So we know that this is something significant that a lot of women are going to see in their lifespan, anywhere from age 12 on, right? So we really need to be screening for this so that we can catch it early and help women not suffer unnecessarily. We know that the prevalence increases with age, meaning as you get older, you are also likely to develop a thyroid disorder. And a high functioning thyroid and a low functioning thyroid are both not good. We want a normal, or should I say optimal functioning thyroid. And this is because a thyroid that's normal for someone might still be abnormal for someone else. Meaning that we all have to be in this perfect optimal range for our body, right? Considering everything else that's going on. So the way I look at it is this. When you get a lab test done, and this is commonly done in the beginning of the year, or whenever you go for your annual physical, the doctor checks a test called TS, which stands for thyroid stimulating hormone. Thyroid stimulating hormone is a hormone that's released from your pituitary gland, which is a small little gland in the brain that regulates a lot of hormonal function in the body. It releases this hormone to stimulate the thyroid gland, right? The thyroid gland sits in your neck. So it comes from the brain, stimulates the thyroid gland. Why does it do that? Well, it's trying to tell the thyroid gland that, hey, I am sensing that there's not enough thyroid hormone floating around in the blood to do what we need done. So please, thyroid, release some of this hormone for me so that we can get this stuff done. So TSH comes, stimulates the thyroid, like knocks on the door of the thyroid and say, hey, release some T3 and T4, which are your thyroid hormones. Once those are released, now we get to the next step, okay? So what happens in the thyroid is that the thyroid finds iodine, yes, iodine, and it uses that to make some thyroid hormones. And it makes them in the form of T3 and T4. Those are the most common ones that we talk about. There's other hormones that the thyroid makes, like T7, that we're not going to talk about that today, okay? But let's say T4 and T3 are the main hormones the thyroid makes. The T4 is what we call the inactive version of the thyroid hormone, and the T3 is the active version of the thyroid hormone. So the thyroid makes them in a certain ratio because it doesn't want to release too much active thyroid at the onset. It releases more T4 and then allows T4 to travel to different parts of the body and then let it get converted to T3 from there. And if you think about it, this makes sense. You don't want to release an active hormone directly into the bloodstream all at once because it's going to start stimulating things along the way that you don't want it to stimulate, right? So the body decides, okay, we're going to make this in 2 ratio, right? In a certain ratio, higher for T4, the non-active, and a slightly lower ratio for the T3, which is the active. And as that gets to the body, where the first place where it gets converted is in the GI tract, which in the gut. It gets converted from there to the active form. And then the body can take it and circulate it to the tissues that need it. For example, for your hair to grow, okay? For example, for your temperature to be regulated. For example, for your heart to not palpitate. There's a lot of things that the thyroid does, and we'll go into it in a little bit. So you have this happening, and then those functions are able to move forward as needed, okay? So what happens in some patients? Why do they get this condition we're calling Hashimoto's? Well, Hashimoto's, the name comes from the name of the doctor that discovered it, but what it really means is that the thyroid itself is functioning fine, meaning it's responding to the signal from the brain, the TSH, and it's able to produce T3 and T4. But the immune system senses that there's something wrong. And the immune system decides, just like it would make antibodies against viruses or antibodies against bacteria, it decides to make antibodies against your thyroid gland. And the thyroid gland starts to get attacked by these antibodies, which creates this cascade of inflammation, swelling. Sometimes we find goiter, nodules, and this starts to disrupt the function of the thyroid, right? Think about it. If you're being attacked, are you going to be able to be making food? You can't, right? You're going to be running for your life. You're going to be trying to hide. Well, that's what the thyroid is busy doing when it's being attacked by these antibodies. Even though it has the ability to make thyroid hormones, it just cannot make it efficiently because of the attack, because of the inflammation. Okay, so think of it that way. Okay, Hashimoto's is an inflammatory disease on the thyroid caused by the immune system. Okay, I hope that makes sense. Again, the thyroid itself is healthy. What's not healthy is your immune system wrongfully attacking the thyroid. And if we don't get the immune system under control, we're really not going to get the thyroid better. I want to drive that last part home because a lot of conventional treatment on Hashimoto's has been they've been band-aids because they are not treating the underlying cause. They've been treating the symptoms of Hashimoto's, which I'm going to go into in part 2 of this video, because the symptoms of Hashimoto's makes the doctor give you certain medications to try to reduce those symptoms. But at the end of the day, what needs to be addressed is your immune system. Find out why is the immune system attacking your thyroid for no reason. Well, at least seemingly no reason. Join me in the next video so you can really get to understand a little bit more about this disease. It is not something to just be watchful waiting, which is what a lot of doctors do, right? We see the antibody levels elevated and we say, well, I mean, there's nothing we can really do about it right now, and we just kind of let it sit, and then we keep watching it, or sometimes just even forget watching it, right? So that's what I tend to see in my practice. A lot of patients that have been diagnosed, just been put on thyroid medication to kind of manage their symptoms, but no one is addressing their autoimmune situation. So join me in the second part of this video so that you can really understand how we like to treat this more holistically by addressing not just the thyroid dysfunction, but also addressing the immune system, which is the real underlying cause. I'll see you on that one.